Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. I am delighted to welcome you to episode 2 of the Health Innovators Show. And I have to say, my two guests today are extremely special friends of mine. We've known each other for almost 10 years. Terry and Manas, delighted to welcome you to the show. We're going to talk about Diep Foundation and Breast Advocate app. Terry, let me hand over to you first. Short introduction, and then we'll get into the sort of innovations that you're involved in.
Gareth and Dr. C, it is delightful to see you. 10 years, unbelievable. The work that each of you have done inspires me daily. So I am the founder and director of Deep Sea Journey Foundation. Started in 2016. I can't believe that much time has passed myself. Very, very honored to be with both of you today. Thanks for inviting me, Gareth.
Oh, it's an absolute pleasure. And Manas, it's a pleasure that you can join us. Just a short introduction for those who are just joining.
Well, I trying to follow in your footsteps, Gareth. Doing and trying to do good things and sleep well at night. I'm a breast reconstruction microsurgeon by trade, turned digital health junkie, trying to basically combine tech with patient advocacy and shared decision making to empower patients and help them make better decisions while unburdening the healthcare system. So I think all three of us are so well aligned. I'm really looking forward to talking to you both today.
Fantastic. And I think this is where we start and we get into it, the personal journey and the inspiration. So I'm going to put this to both of you. Ladies first, of course. Terry, what inspired you to pursue a career in innovation, particularly in the health sector? And then also share a defining moment in your journey that solidified your commitment to the current project, which is the Deep Sea Foundation. Over to you.
Thank you. Well, it was really my second breast cancer diagnosis it was a pivotal moment in my professional career. To, absorb a diagnosis is difficult for anyone. And then to find the support that you need to understand your treatment, to gather your caregivers together, all of that becomes an extremely overwhelming process. One that, so many cancer patients that are faced with cancer, they just don't know about, and they have to learn so quickly. So my professional background my interest and passion has always been and always will be the transformative power of providing education. So why wouldn't I answer the call to help others who had been through what I had been through? Why wouldn't I? I already had the tools in my tool belt with my professional background as an educator. And it really was important for me to be able to share my own lived experience, combining that with what I had been taught throughout my entire career about the power of education. A pivotal moment, literally and figuratively, I answered a call. And that call came from Dr. Minas Chrysopoulou. I was sitting at my desk one day, Gareth, and I got a phone call from him. And he said to me, Terry, I think you should open a nonprofit foundation. Now, in life, sometimes we all need a nudge, right? It's truly inspiring and lovely when that nudge includes a mentor. And so the day that he called me to open the nonprofit, I answered that call. And in 2016, that's when I opened Deep Sea Foundation. He has stood by my side since then. Mentors in life guide you, they direct you, they stand by you, and they don't leave your side when they ask a question. And I answered it. And so that was truly the pivotal moment in my life to receive that call. And just super happy to continue this work.
Yeah, amazing. This is why we have the two of you together for this particular show. We couldn't have one without the other. Amazing insight. This is what's inspiring. This is actually what inspires me. I'm sure Dr. C as well. The reason why we do what we do, we want to help people. Manas, the same question to yourself. What inspired you? We know why you're in the health sector. The surgery that you perform. Can you also share? That sort of moment in your career where you said, right, I'm going to set up Breast Advocate.
Yeah, for sure. First off, Terry, thanks so much for the very kind words. It means a lot, really does. When you finish your training and you come out and it's all about the technical expertise, right? So you come out into the real world, start a practice, and it's all about being the best you can be technically. And then after a while, you realize that as a surgeon, there's more to being a great surgeon than actually just doing the procedure really, really well. So I got to the point, I'm exceedingly lucky. I'm in a very wonderful group surrounded by very passionate people. We all share the same passion, which is rebuilding lives after breast cancer. My practice is practice in San Antonio, PRMA, plastic surgery. We see people from all over the place, across the US and actually outside, other countries. So what's interesting is you get to a point in your career where, other things become important. You start asking yourself, how can I do better? Where are the holes? You start analyzing the patient journey. And as a result of being in the blessed position I found myself in this practice, surrounded by this team, I realized I kept hearing the same thing from patients. And that was, had I known then what I know now, and fill in the gaps, right? I would have chosen something different, or that was the pleasant version. Other patients were angry that they didn't know certain things because they had made healthcare choices on information that they thought was fairly complete and robust, and now turns out that they were very unhappy because there were all these options that they hadn't even been aware of. And so I started looking into it. I came across shared decision making, which is a paradigm shift in terms of the way healthcare delivery is approached. I grew up in a system that was very paternalistic. I'm old now, so at medical school and in training, you basically sat there and you followed the consultant and you copied what he did, and that was it. It was a glorified apprenticeship, essentially. And the interactions between my consultants and patients was very much paternalistic, maybe informational. Here's what I think we should do, and here's why. Maybe conversation about risks, but very minimal. And the response was, yes, doctor, you know best. So when I came across shared decision making, which isn't a new concept, it's been around since the 80s, and I was exposed to this concept of true partnership between a patient and the healthcare team, exchange of information, the acknowledgement that the patient is also an expert, just like the physician is, but they are an expert in something different. They're an expert in their own lives. They're an expert in their preferences, their values, what's important, their job, their support structure, all these things, whatever they feel is important that goes into making the proper and best healthcare decision for them. That's their expertise. And so shared decision making basically marries that with the physician's expertise to come to the best treatment plan together. It's a collaborative thing. So anyway, I thought that was really cool. That's the way I'd want my family to be treated. So I thought, well, why isn't everyone doing this? Then, it takes more time, it takes more commitment. It's all these struggles in healthcare, all these pressures. You're lucky if you get 15 minutes with your doc these days. And then plus it was a different approach than I was used to in terms, like I said, in terms of training. So I thought, well, there's got to be an app for this, right? For breast reconstruction, there's got to be an app out there. And there are plenty of apps about, with information, but nothing that really checked the boxes that I was looking for, which was delivering information in a way that empowers the patient, gives them 24/7 access, and gives them the tools to have the conversation they want to have with their healthcare team. So long story short, I couldn't find what I needed, so I put a team together. Tolman Health was born. That's the parent company, and our first foray into digital health was the Breast Advocate app. So it was created out of necessity for my patients at PRMA, and then after we launched it, it kind of took off. People liked it. People still do. They use it. It's free. The defining moment for me, I was very happy to get it launched, and I was happy to introduce it to my patients. I think really the defining moment for me in terms of commitment was the process I used to actually create the app, which was incorporating patients from all demographics involved in what we're talking about. So breast cancer, high genetic risk, predisposition to breast cancer, all the options in terms of breast cancer surgery, all the options for reconstruction, aesthetic flat closure, women, men too, because men get breast cancer as well. So I put these groups together, and Terry was a massive part of those patient groups. And after meeting with the group several times and understanding how, I thought I was a good doctor. I thought I was doing a pretty good job, but turns out I could have been doing a way better job. And then once that was really, that personal growth really was very significant for me. And that's what solidified things. I thought, okay, we're onto something. We've got to see this through. And that was it. Long-winded answer, but that's now
but it's important to set the context, and I think it leads us nicely into, both of you are covering breast cancer here. I think I'd like to, firstly, Terry, go back to yourself. You're providing a platform for patients to engage. How does your innovation, which is innovative in many respects, because you're very much the patient voice, and advocacy is critical in terms of outcomes. How do you feel your approach is improving the current approach, in the system at the moment? It'd be great for you to expand on that.
What I saw was lacking was access to care, patient support, and providing patients the information, the help, the encouragement on how to communicate with their healthcare professionals. Mm-hmm. That doesn't come easy for everybody.
No.
And so time is such a critical factor in a clinician's practice. We all know that. Time is so valuable. So really what I hope to do and where I place myself is between the patient and the healthcare provider. It's a very comfortable space for me to be in. When I think back, Gareth, when I was in the teaching industry, I had administrators, I had students, I had specialists in education, parents. So I had all these people surrounding me, and I was kind of in the middle of that space. Now I'm in that space with patients, the healthcare professionals, surgeons, and also industry, to be honest with you, trying to improve patient outcomes So, by providing support, which I'll talk about in a minute, how we go about doing that, but providing this support, I think what it really does, what I attempt to do every day, is to improve the healthcare sector by improving on that minimum of time that's available in clinic. If we have resources where patients can sit and listen and learn, evidence-based resources where they can sit and practice what their clinic is going to be like, they can go into the clinic prepared. They can go into the clinic with some decisions already made. And my strong hope is that we empower them to use their voice and to practice a shared decision-making model that, Dr. C just spoke so eloquently about. It doesn't come easy for everyone, like I said. So I feel so fortunate that I've been able to scale this by using social media. And I'm going to add the word responsible social media, because it is the Wild West. And I think that it's very important as a curator of content, as a person who provides support, that we use social media responsibly.
Great.
Because at the end of the day, I feel that patients want evidence-based information. They want to know how to communicate. I know that the gift of education, the gift of being able to communicate properly with your healthcare provider and feeling like you are an integral part of the decision, it is a priceless way to support patients and to share information. And so that's really that's the gap that we're trying to close at the foundation, and hope to do that every day by the resources provided, which really, is done with the help of a lot of the healthcare profession.
Yeah, absolutely. So Manas, let me just come to you, because I got to just go on to the impact side, because, both of you are trying to solve an innovative approach in terms of shared decision making through Breast Advocate and through the Deep Sea Foundation. The impact and the outcomes, what is the impact that your sort of innovation is having on the communities? And then expanding that, like, where do you see this going from a global health perspective? And then how do you measure success and effectiveness of Breast Advocate, for example?
Yeah, and to hitchhike off of what Terry just said in terms of access to evidence-based information, our approach is really to focus on where the patient is most of the time, and that is not physically with the physician or with the healthcare team, right? So 99% of the time that they're thinking about their illness, it's outside of the clinic. So technology is an absolutely vital component of giving people the information they need 24/7. So in that regard, it really does unburden, potentially, it has the potential to significantly unburden health systems globally. And ultimately, when you look at the impact of empowering patients in their decision making, what are those impacts, right? It's increased buy-in. When you have full education, you have increased buy-in. You have less decisional regret. You have far better compliance. You have ownership. You have increased patient satisfaction. But most importantly, and this applies to beyond breast reconstruction and the treatment of breast cancer, there are studies really that have looked at shared decision making across subspecialties, and they show very, very consistently that clinical outcomes are improved when you use a shared decision making approach. So I think if our goal ultimately is to take what we've learned with Breast Advocate and white label it and apply it to all countries, all languages, different healthcare systems, and help patients everywhere really navigate access to their local options.
Yeah, fantastic. And what an opportunity, because you're not talking about just a small number of people here. You're literally talking about millions of people here globally. There's a big need, being able to improve people's quality of life, and then the knock-on effect that these decisions have on a family. It's very important that we put that structure in place. I wanted to talk to you both about the challenges and the learning experiences. So let me first put to you, Terry, the challenges. You may have talked about social media. That could be a big challenge to manage all that. What has been the biggest challenge you faced while developing your innovation, and how have you overcome that? And then I'll come to you and ask, just like, if you could share some lessons and what you would share to some aspiring innovators. So Terry, over to you.
Well, in this space, honestly, one of the biggest things that I've had to overcome is just to tamp down the naysayers. Not everybody's going to agree with you, but honestly, I believe if you are not out there enough in life, I don't think you're being distributed widely enough if you don't have critics in life, right? So you have to embrace the fact that there are going to be those who may disagree with you. Now, the other big challenge, as I spoke about earlier, is time. And time is of such value in this space. And you really have to understand what your capabilities are and try to balance your own time, because it becomes a challenge. It becomes a challenge when you're trying to tackle all problems. And my gosh, Gareth, what more perfect example is there than you? You have done such great things over the 10 years that Dr. C and I have both known you, but you can't conquer all things. And so I think it's really important to balance in your own life the time that you have to, try to tackle problems when you open a nonprofit foundation, find the support you need. Those become very critical, and you do have to find that balance. So the lessons that I've learned from this really are primarily from my mentors in life. Some of those mentors have been other patient advocates. The connection that I continue to have with them and the new patient advocates that I meet, it's very inspiring for me. You cannot not ask for help in this space. And I've been so fortunate. My strongest mentor, as I mentioned before, is Dr. C. When you look at the gifts that they can give you, opening a nonprofit is opening a business. And so when I look at the success that he has with Tolman Health, with Breast Advocate, and the award-winning app that he developed, when I look at the success that he's had developing and nurturing and starting and continuing to grow a world-class plastic surgery practice, those are the attributes that I have benefited from as a nonprofit founder. So I encourage those that are in this space, when you meet those challenges, find those people that will guide you, because there are going to be days when things don't go so well, and you need to lean on those people. So.
Absolutely. And Manas, from your perspective, challenges, learning experiences?
Well, initially you're forced to wear a lot of hats, right? Whenever you get any venture going, and in terms of advice, I would say be very quick to recruit help from subject matter experts that you need, and align yourself with with expertise and people who share the same passions. And you know, starting a business, obviously, you know, you're trying to keep costs down and you're watching every penny and all the rest of it. But, you know, sometimes the cost of time is far greater than, you know, getting the right team and kind of sharing the wealth, as it were. So that's what I would say is find people who are passionate about the same things and see how you can work together. And it's actually more fun that way too, I think.
Absolutely. Shared values. And next protocol, sustainability and future plans. Okay. I noticed, Terry, you're always kind of post about the sustainable development goals in your posts. You're very aligned to good health and well-being. Maybe you could expand a little bit on that. And also, what are your future plans? And then Manas, same question to yourself.
You know, all of us have talked about the sustainability. To me, is health literacy. We've all talked about this before, and it just is so key to helping patients with this whole process, because health literacy comes in so many forms. We have cultural issues that we must deal with. We have demographics, geographic areas that have different financial, abilities and backgrounds. And so we have to deal with all of that in health literacy. And another strong factor that we're going to continue to nurture with the Sustainable Development Goals is community. We've also talked about this. Community goes back centuries ago, you know, in time, where we sat together and shared common, experiences. And in the breast cancer space, this becomes so valuable and important. I look at your community section, Dr. C, on the Breast Advocate app, and how nurturing that is, and how much that encourages patients to ask questions and to become part of that community. Community also leans in on mental health. It improves mental health when you can find like-minded people. Scaling what is the future? I'm going to say it. It's AI. And I just talked to a surgeon this week about this. And again, I feel that as we curate content, as we are leaders in this field, it's our responsibility to guide people to understand how to properly use AI for all of our benefit. And so I feel like that's the future, really.
Definitely. I'm going to ask from your perspective.
She stole my thunder. You know, she said everything. Terry, you said everything I was going to say. You know, the communication and you know, healthcare related education and communication, access to information, as Terry was saying, that's really at the core of what we're doing. Improving access to as many people as we can, to address as many inequalities, social inequalities as we can, right? And so it's interesting how the definition of that varies depending on, you know, geographic locations. And, you know, one of the biggest lessons we've learned as we put our team together has been, you know, the impact of culture and how diverse the factors are that you have to consider in achieving these goals in different countries and, you know, different backgrounds, different cultures. But yeah, I echo Terry's sentiments. We're all obviously very much aligned in this.
Mm-hmm.
So, we've only got a few minutes left, and so what I want to try and do is like wrap up. We've got a couple of questions left, so we'll try and do this nice and quickly. But I wanted to go back to you, Terry. You know, collaboration, partnerships. How important have partnerships been to develop your innovation? And like, can you know, is there any key collaborators you'd like to mention? And And like, I would just also like to ask, like, what do you see as the role of cross-sector collaboration in terms of driving the meaningful innovation that you've developed?
Well, at the core of collaboration is always going to be patience for me. That's where the rubber hits the road. But I have to tell you, I have been so excited to see over the last few years that now industry is starting to embrace collaboration with patients and to, really embrace the patient story, because we are the ones who can share and improve the industry that is providing services for us. So I'm excited about that, but I also just kind of say it with a little bit of caution too, because we have to always protect and respect the patient's story. But that is one part that I've seen that I think is so valuable and important. And I just think that you have to find people that are like-minded and reflect the ethos and the goals that you have set forth in your work, and align with them. So really pleased to see that cross-sector happening over the last few years.
Yeah, it's absolutely crucial. And Manas, from your perspective, collaboration partnerships?
Well, I think it's time for a plug for WHIS. I think the work you're doing and being able to work together with you and WHIS, and certainly the other collaborators and potential partnerships that you've introduced to both of us has been really phenomenal, and I thank you for that. And one that I particularly value is going to be talking to you soon.
Yeah, absolutely. So, but I think, like, so one of the learnings for me, when I worked in the National Haemophilia Council, was the patient. So as Terry mentioned, and what I found when I left the National Haemophilia Council was that we didn't have patient engagement. So with WHIS, what I was trying to do was like bring patients, clinicians, managers, voluntary sector, education, and the business community. But there is one other element that I think is critical here, which is what we're trying to bridge at the moment, is the investors. And I think they're the ones that we need to bring to this conversation. And that's a critical part of what we need to achieve, especially if we want to scale these solutions like Deep Sea Foundation and provide the capital that's needed to grow. And same for Breast Advocate. This is what's going to really change the dynamics, of what we're doing at the moment. And I'm really excited about these opportunities. I think this is going to be a game changer. Just finally, both of you, what advice would you give to aspiring innovators out there? And then also, just finally, if you could tell us, how do people get in touch with you? So back over to you, Terry.
Find your tribe. I'm sitting with the original tribe right here. This WHIS group that you started 10 years ago, Gareth, has been so inspirational for me. I think that young people are more reticent to kind of, find their tribe, ask for help than maybe those of us that have been around for a bit. So I encourage you to find your tribe. And because at the end of the day, you're going to need help. You're going to need help in all forms, whether it's, emotional, educational, all the things we talked about today, financial. And at the end of the day, you need to be able to sit with your tribe and ask for help. So I want to say a huge shout out to the two people that I'm sitting with today as my original tribe. And thank you both for everything that you've done for the foundation and for patients.
I don't know what to say. Thank you. It's just such a pleasure to work with you both, to be honest with you. Manas, for yourself, what sort of advice would you give? Like, we have to also just talk about resilience, motivation, you know, during the ups and downs that we face, because we've all faced it here. What advice would you give? Because there's going to be a lot of people watching this, and how do I get involved? You know.
Yeah, I think, you know, listen to your passion. I mean, honestly, there's no better place to start, especially if you combine your passion with a pain point that you're experiencing within that field. There's no better place to start in terms of, you know, getting involved and providing a solution or trying to find a solution. So, so that's what I would say for someone starting off. And then in terms of resilience and dealing with the ups and downs, you know, I'm gonna be hypocritical and talk about two things that I have historically done badly, and that is take care of my physical and mental health.
Yeah.
Because if you're not healthy, if you're not physically healthy, if you're not mentally, you know, in good shape, it's a massive problem, right? So the problem is that as as things develop, you get busy, you're trying to move things along. The easiest thing to lay to the side and ignore is your own needs, right? Especially if you have a family, because you're going to tend to them, and you know, you're busy, you're away from them, you get back, and then what do? Well, you don't work out, and then you don't give yourself, you don't meditate, you don't do that, you know. So I think we can all associate with the difficulties there, you know. So I would say the way around that is actually to prioritize it, right? So if I don't work out first thing in the morning, I'm not working out that day, and that's just my life.
Yeah.
So you got to prioritize things enough to make sure they happen.
Absolutely. I totally agree. Well, look, it's been a pleasure speaking to you both. I just want to put back to both of you very quickly. Terry, how do they find out more about the Deep Sea Foundation?
All social media links. Look for DIEPC, the letter C, Journey Foundation. C stands for the first initial of my last name. So Deep Sea Foundation, Deep Sea Journey, all social media accounts. Look for us online.
And Manas? So for Breast Advocate, you can learn about us at breastadvocateapp.com, and then we're on you know, throughout social channels too. And then the parent company, which is the digital health company, is tolomanhealth.com. So you can learn all about white labeling and our process there too. And you can always look me up individually, LinkedIn, Twitter.
Fantastic.
Whatever you fancy.
Well, look, this is our second episode. I'm just going to plug our third episode, which is coming on November 29th at 1 p.m. We'll be talking to Ride for Freedom, Gordon Miller. So I hope you can join us. Terry, Manas, it's been a real pleasure speaking to you all. Thanks for joining the Health Innovators Show, and we will catch up very soon. So thanks everyone for tuning in, and we'll talk again very soon. Thanks everyone.
Thanks, Gareth.